Hey guys, so today we're going to talk about post-stroke headache and what exactly we're doing with somebody who has a headache after they've had a stroke. So I saw a patient a few years back with a headache. He came in after having this thing called a P2 occlusion in the back of his brain. Basically it caused him to not be able to see on one side, and he came in with headache. And one of the things that you always worry about with a post-stroke headache or something of this nature is you always worry about A, is a person having another stroke, because headache can be associated with strokes, or B, is he having sort of this post-stroke headache syndrome, or is he having a subarachnoid or subarachnoid hemorrhage? So these are the things that you worry about, especially with a headache. Or can there be sort of this stroke that's associated with migraine? That's something that we always consider and worry about. Is there any treatment for it? Well, oftentimes, when you do have a person who's got a headache, you oftentimes think that the first thing that you're going to treat that person with is Tylenol, because Tylenol is the easiest thing to treat, or paracetamol if you're in India. So these are the easiest things to actually treat the headache with. The second thing you want to do is you want to treat your patient with maybe something like Depakote. I found that Depakote actually really works well. Sometimes Keppra can be used for working to help people's headaches. And what happened in this case in particular is that the patient ended up having this occlusion, and then we found that the patient's actually having a worsening stroke and a recrudescence of their stroke that's actually taking place. So what we did, as this was a few years ago, is we admitted the patient. They didn't have any furthering clot that you could see in the brain, but they had worsening stroke. So the ultimate treatment was, number one, Tylenol. Number two, it was to increase the medications, as in change it from aspirin to aspirin and Plavix based on the clinical trials that are out there. And then we used Depakote in order to stop the headache in the short phase. Is any of this proven in a clinical setting? No, it's not. It's not proven, and there's no real clinical trials in the post-stroke headache situation. But this is something that was really important to touch on, because post-stroke headache is a sincere problem. It's something that that we know a lot of patients have. Stroke while having a headache is also a problem. You think subarachnoid hemorrhage, or you can think other causes such as migrainous stroke, which isn't sort of a term that's well accepted, but some people believe that this is actually something that takes place together. So those are the other videos that will be coming out of this video. So if you're interested in learning about post-stroke headache, this is important. And then if you're interested also in learning how to calm yourself and calm your mind, one of the best things that you can do is buy my book. Our book is called Meditate or Die, KneeTie to Get High. Please check it in the link below. This will certainly help you. Say you're having headaches, you can use the third meditation in this book actually can be used for pain, and you can go right to it. A lot of times my patients will ask me, what can I do for pain in the brain and pain in their head? And oftentimes they'll choose medicines before they choose meditation. Say I get a migraine headache, I've actually found out how to use meditation to decrease my pain score by at least 2 to 3 points, and then I'll use exercise to decrease it, and then thereafter I'll use these meditations. So one of the clinical trials that I probably will be doing in the future is to actually take a look at, does meditation help headache? And this is something that's a very important topic. A lot of people want to know, and there's a lot of papers that are already out there on the topic. But does meditation actually improve headache? And of course, I'm not saying that in a subarachnoid hemorrhage situation that you want to use this as a sole means of improving your headache. Of course, we want to use medications to decrease the headache. But say you're having a chronic headache situation, have you tried meditation? Have you tried to simply go, run, go? Saying go, run, go over and over and over again for your headache. All right. So that's my 5 minutes of content today for post-stroke pain and post-stroke headaches.